Over the last few days, Barbados registered well over 500 new cases of COVID-19 per day. The local numbers coming in at 923, then 723, and 767 new positive cases recorded on the local COVID-19 dashboards for Monday, Tuesday, and Wednesday, respectively. But in reality, the local COVID-19 numbers daily are much higher. And to find out by how much, the Deputy Dean of Medical Science at the UWI, Dr. Kenneth Connell, wants local health officials to include results from home testing in the daily count of COVID-positive cases. He says to make this happen, government should encourage people to test more regularly and send in their results.
Yes, there is a role for home testing, and possibly what we might want to consider now is how do we capture people who are doing home testing if they do test positive, so that you can't just test at home and not report it, but the capturing mechanism for that, so that it takes less stress off of PCR testing and probably has the opportunity to test more people, and more importantly, to test more people more frequently.
The consultant internalist at the Queen Elizabeth Hospital contends to continue the current PCR testing focus is simply too expensive.
So I think that we should follow the current evolution of what is happening. And I'm not trying to sidestep your question, but there are important data currently being analyzed at both the WHO level, looking at the reliability of the test, the cost of the test, the cost of testing. It's something that's obviously very important to small island developing country because we can't afford massive PCR testing.
So for Dr. Connell, health officials need to move to the next step regarding testing.
What you want to do is to try to encourage accessibility to tests, so they're cheaper, they're available, they're more reliable, and people can more importantly repeat them. Having a COVID test should not be a monthly event or even a 2-weekly event, because it's really only telling you what your status is at that point in time. And so to summarize, then I would say the administration, as the rest of the world is now coming to grips with, needs to consider what question is being asked, whether we are more looking at the sensitivity of the test, or should we be concentrating more on the sensitivity of testing in general.
Dr. Connell spoke exclusively to CBC News as we await the latest dashboard from the Ministry of Health and Wellness. Shane Seeley, CBC News.